Thank you. And in the interest of full disclosure, I'm a native Californian, not from Illinois. I am a farmer's daughter. My family raised cotton, corn, and kids. I'm the youngest of 5, and it's my sister's birthday today. So I'm ready to begin. You do something to this to make it come up? Just click the space bar. Hooray, we are. Understanding consumers' perspectives. That's my focus. And what does affect food choice? I believe this was presented to you by one of the speakers this morning. It's taste. We buy what we like to eat, what tastes good. Convenience wasn't on his slide, but look at your own life. That's something we care about too. Price must be affordable for us. Health or nutrition. Sustainability is a growing interest. People aren't sure what sustainable means or how to measure it, and they question a little bit if it's been whitewashed on sustainability, but it's something they are attuned to. I was asked, I believe safety is not on this list. I believe it should be. It's not on the list because people assume the food is safe. And we'll speak more about safety in a moment. What about world hunger? Americans are compassionate. When they see starving children, pictures of starving children or families in distress, when they see national disasters, they give. They give their dollars, they give their supplies, some fly over and give their time. But I believe world hunger is not a poignant concern for them. They don't think about it every day. Their concerns are, how do I get my kids to eat vegetables, and what am I having for dinner tonight? And so world hunger, while altruistic, and the needs are indeed strong and very important, they're not top of mind for today's consumers. Now, I mentioned food safety, and that is an area that I look specifically, consumer attitudes toward food safety, food quality, handling new technologies. We do indeed have among the safest food supplies and affordable food supplies in the world, but we're not perfect. And there are cases of foodborne illness every year. Some of these because of mishandling, some because a product has a pathogen and that we're not able to get that pathogen out of the product. And this must be reduced. Patricia Griffith from the Centers for Disease Control and Prevention says, is it reasonable that if a consumer undercooks a hamburger, their 3-year-old dies? Of course that's not reasonable. We have technologies today that are available to prevent that. They're not being used. This is an issue of communication. This is where we must work together to enable the agricultural community, and I include food processors on that, to use all the tools available at their command to safely reduce foodborne illness by destroying these pathogens before they're brought into the consumer or food service kitchen. There are instances in the news all the time that talk about foods, and in this case, technologies not being used that impact safety. When I prepared these slides in January, the issue in the news in California was raw milk and children in the hospital from E. coli. E. coli 015787 and some others that produce a special toxin are particularly fearsome for me. I guess I've heard from too many parents who have lost a child or had one permanently disabled. This organism attaches to the gut, and pretty soon one of the signs is, in addition to horrid pain, is bloody diarrhea because the person's bleeding from where the organism is attacked. It is horrific. And there were children drinking raw milk in the hospital because of that. Right now, there's children in the hospital, or not children, families, I don't know, over 70 people, I think it was over 76 last night. In Pennsylvania, raw milk, Campylobacter, not E. coli, Campylobacter. Campylobacter is associated, Campylobacter infections are associated with a syndrome that causes paralysis. And it is the most common non-accident related paralysis in the United States. Raw milk. We can pasteurize that milk. We need to have more effective communication. What are the benefits? What are the risks? What does the science say? There is information. We haven't been able to reach people. And you know, I'm talking milk, I talked about meat, but it is amazing that looking at the most recent outbreaks, meat-related, it's not the most common. It's fruits and nuts and vegetables. And again, think, very recently, cantaloupe, listeria, deaths. We also had in Europe, sprouts. More people killed in that outbreak than anything Europe has ever had before. There's a technology available that could have stopped that. It's not being used. Sprout recall right now. Jimmy John's sandwiches, I think is that an Illinois company? That could be stopped. It is not. So agricultural production and food processing are under attack. These areas both are presented by those who are attacking as profit hungry, careless of the impact of their activities on human health, insensitive to animal health and animal well-being, and in ignorance or uncaring about environmental consequences of production practices. As I mentioned to you, I grew up on a farm. I know farmers. There can be bad actors in any field. But the people that I know, and I trust the people you know, care about the environment, care about their families. I mean, it's their livelihood, isn't it? They have to care about the environment because if they didn't, they wouldn't survive. This is a communication piece that must be addressed. Our common values, our environmental stewardship, human health, allowing our young people to grow to be productive and to experience happiness. We need to have that base of communication. Some suggest solutions, which may or may not have different benefits, but which don't really impact safety or sustainability or health. Some of these solutions are buy local. You know, there's good reasons for buying local, like supporting your farmers, your local community. That's a good reason. To think that local food is safer than non-local food, hey, show me the science on that. Buy organic. It's a good reason for supporting organic farmers. It gives the farmers a chance to practice their beliefs, and it may provide higher revenue for the organic farmer, depending upon what their yield and input is. But to suggest that organic farming is more sustainable, gosh, you got to show me the data on that one too. I have not seen that justified. To say that it's safer or the products are more nutritious, show me the science. Many have looked at it. People have found there is no documentation that there's a significant difference. Some have said certain fruits and vegetables should be avoided because of pesticide residue. The data does not support that conclusion. The impact, if families really do, if parents really do avoid certain fruits and vegetables that are very popular, they could be putting their kids at risk. Because one thing we know we should do is eat more fruits and vegetables and eat affordable fruits and vegetables. Avoid processed foods. It's another recommendation. Hey, what's processed foods? Do you like rice? Who wants to go out and harvest their own, shuck it, and then cook it? Buying rice, either white or brown, they're both processed, right? I like to make my own bread. I enjoy it. The house smells great. I'm not going to go grind that wheat to make the flour. So what kind of processed foods are we avoiding? A colleague and I did a literature review of fresh versus canned versus frozen, looking at the key nutrients in fruits and vegetables. And our conclusion was they're pretty much comparable. And in fact, we could even give you examples where the lycopene, that is an antioxidant that is shown to be effective in, may be effective in reducing instances of prostate cancer, higher level of lycopene in processed tomatoes than in fresh tomatoes. The heating opens the plant cells and makes it more bioavailable. So what do you mean? Avoid processed. And then demand labeling of genetic modified foods. And the reason they want it labeled is so people could avoid it. Well, is there a risk associated with genetically modified foods? I mean, show me the data on that. I don't see it. And if you believe in sustainability, there is data on where these products can allow more productive, more sustainable and energy efficient farming. So these messages haven't been communicated. There are technologies that can reduce risks, like the pasteurization of milk I mentioned, using food additives and preservatives that allows food to be more affordable for families without impacting nutritional value. Genetic engineering, as I said, has benefits of sustainability. Irradiation, that is the only technology I know of that could make sprouts virtually free of harmful things like E. coli. It's not being used. The agriculture and food science community needs to increase communication to the lay public. Now, I acknowledge, as a university professor, I'm keen to communicate. I'm ready to talk in 50-minute slots. We need to do that shorter, and I too need to remember that the first step in communication is listening. Hearing from your target audience, understanding their concerns, addressing their knowledge, determining their information sources, and then providing information about what is being done, why. If they care about the safety, discuss it. But I really love that iPhone example. I don't care how my iPhone works. I really don't care how my computer works. I just want to download those pages and hurry up. We need to make these statements personal. We need to make them compelling. And then we need to evaluate their effectiveness. I have some ideas on how to address this concept of processing, the concept of factory farms, but I haven't practiced it with the target audience to see if I'm understanding what they see and to see if my message to them is compelling. Is it credible? And is it actionable? We must have the communication. We must increase it. I applaud you in your major. Without communicating about these benefits and addressing concerns, these innovations will be much more difficult to realize, and the challenges of tomorrow will be much harder to address. Thank you.